I mean, many children are jumpy, fidgety. That's because they're children, of course. However, children with ADHD, after a certain time, begin to find the common developmental goals, let's say like academics or peer relationships or self-regulation, difficult to do. So when these things become dysfunctional and we find that a child who otherwise seems intelligent and capable is unable to do these things, we then begin to suspect ADHD. There's a wide range of therapies that are available for it, medication being one of them. And also be aware as parents, as teachers, that when you suspect a child with ADHD and send them for an evaluation, it is not mandatory, it is not a must to put them on medication. Because a lot of the times, parents particularly, and even sometimes teachers in schools fear this. And therefore they're often very hesitant to go down that route, the medical route or the psychological route. And that's the other thing that we must remember, that there is a solution. The kind of children that we get in our center at Children First, and we get hundreds of children with ADHD, are often very bright and capable kids. However, by the time they come to us, their story has become a lot more complicated. So rather than seeing their strengths and their intelligence, people have begun to criticize them, or have done so over a period of years. What they turn up with to us, in front of us, are with very negative stories, negative narratives of their lives, and that is actually, we believe, is more damaging than the ADHD itself. And these kids then begin to get into depression, and they have anxiety. Some of them start taking substances to relieve some of this distress, and some others might rebel hugely and big time, and then be termed as having a conduct disorder or being antisocial and so on and so forth. There's no question that if we do not treat ADHD well, it can become extremely complicated and indeed become dangerous, right? Because kids who are not treated well by the school, the education system, by parents or their peers, often take the other route, and then they begin to identify with groups of other kids who may be doing things which are antisocial, maybe again, like I said, get into substances, or then gradually get into antisocial or criminal activities. And there is evidence again to show that if we do treat children early with ADHD, they often have a very positive outcome. Our experience of treating ADHD has been wonderful, and we have so many children who are doing exceptionally well in their lives, going to the best universities, pursuing offbeat careers of maybe being divers or mountain climbers or musicians or actors, and doing so well. So it's a great journey that you see when you begin to treat these kids differently and see them through another lens of how capable they are rather than what they cannot do.